Okay, so guys, this the ST3 orientation session. We're getting the feedback from all the candidates of the last application, all the tips and tricks, pitfalls, what to do, what not to do. So we'll have a presentation from the successful candidates. Then we'll have Muhammad Wahab taking us through the whole experience of all the candidates, what they feel works, what they feel doesn't work, what they feel you should do, you should not do. So we'll start with Ahmed Ashur. Up to you, Ahmed. Ahmed, just guide me if you
Can you hear me?
Yeah, we can hear you. I mean, guide me when you need to move, yeah?
Okay, sure. Right. Thank you, Muhammad, for having me today. So my presentation will be mainly about the interview process, how to master the interview. This is what I have learned attempts of the ST3 interview. So next, please. So a bit of background. I'm an international medical graduate. I have a combined UK and international experience in both orthopedics and other specialties. After 3 attempts of the ST3 interview, here's what I have learned a lot of lessons. So next slide, please. Format of the interview, as you know, it's 4 stations: clinical, portfolio, prioritization, and communication. Each station is 10 minutes. There are several domains in each station, and there is a national ranking system. It is completely according to your performance in the interview and how they score you. It is very... Last year, I think there was over 800 applicants, and there was less than 180 post national. Next. Okay, so first lesson, know the person specification and the marking scheme. So understand how they score you and who they want. There are several areas we have to read about before going through the process. So they can assess you on communication, clinical reasoning, judgment under pressure, portfolio presentation, and awareness of training requirements. One tip I have learned, you have to download most of the recent scoring criteria and person specification from the official website, and you have to print it and you have to learn it, know exactly what they are looking for. Next, please. So this is an example from the official website from the last year application. As you can see, they are marking you according to the criteria in this table. So they will not mark you on other criteria. This is what they mark you. So you have to formalize, you have to make your answers according to these criteria. Next, please. And this is a screenshot, the person specification. You can download it from the official website. Again, you have to print this, you have to learn it, you have to know what they are looking for, and you have to achieve what they are looking for, not just read it. Next, please. Lesson 2, structure is the key. So I think this was my mistake from the early attempt. So I have jumped to the management without having a structure. So basic structure is history, exam, investigation, management. Another example of structures, the SPICE, ABCDE, and time boxing for the prioritization. This is a very important part. I think this was in prioritization. Next, please. Lesson 3, practice under pressure. You have to start practicing with other registrars, consultants. You have to do mock interview with friends, so it's not just studying. You have to record yourself, review the body language and fluency, and you have to time every answer, try to be concise, and at the same time comprehensive. One tip I have learned, you have to, you don't have to, but it can help joining other trauma and orthopedic courses. For example, Let's Talk Doctor, Ortho Revision, etc., etc. There are a lot of online interview courses. You can go through them, ask other candidates, and know what is important, what is useful, and what's waste of time, because there is a lot of these courses are just waste of time. Next, please. Lesson 4, prepare a 2-minute pitch for the portfolio presentation. So this is, there is a question, the opening question in every interview portfolio station: who are you, or how can you sell yourself? You have to prepare this, and you have to start preparing for this very early, and you have to write it, and you have to memorize it by word, because this is a repeated question. You can use different structures, for example, the star in every portfolio question. And a tip I have learned in portfolio station: you have to write every answer before saying it, or at least have a structure in every answer, not just keeping the answer. Next. Prioritization hacks. Categorize patients on the prioritization station according to urgency. Always escalate early, delegate appropriately, and safety netting. I think practicing in prioritization is the most important part. You have to practice it, and you have to you can practice it with your registrars, with your consultant. You don't have to make a station. You can go through the take list or admission list in your hospital, and you can work on it. My turning point: learn to think loud, clearly, and calmly. Thank you. Next. Communication scenarios. Common is common. I think last year NEBAR event was in every day. Other common scenarios: aggregation, DNAR conflict, colleague concern, like alcohol, bullying, missed errors. Use the structure as I said before, and end with a reflection or safe. Final advice: stay calm, empathetic, and always speak like a registrar. Next. So in summary, these are the mistakes I have made throughout my 3 attempts. On the first attempt, I underestimated the pressure. I wasn't very structured. On the second attempt, I didn't master the structure again, and I didn't master the timing. And the third attempt, I've practiced time the station daily for at least 6 weeks before the interview. I attended as many mock interview courses as I could. I refined my answers with feedbacks. I booked my leaves very early. This is very important. In the interview itself, I've been very cheerful, very friendly, and I didn't lose hope. I think this is the most important part. Next. Final tips: start interview early, as I've said before, but don't start it too early. Starting too early could lead to a burnout and will decrease your performance in the interview. You can use real job logs, as I said before, admission list, tech list. You can use it for prioritization of patient. You can practice daily x-rays with your consultants. Whenever you ask any senior registrar or consultant to practice, no one will say no to you. Record your answer. This is very important. Be reflective, honest, calm, but not perfect. And finally, find different study buddies. You can learn lessons from everyone and ask successful candidates for advice. Thank you.
Thanks, Ahmed, for this nice presentation. Very good to make it in lessons, because they are actually lessons, and you keep learning from your mistakes until you reach what's called perfection. It's not an actual perfection, but what's considered the perfection. Well done, and congrats on the post, and hopefully
Thank you.
A very good career progression going on. Guys, because Ahmed will disappear for his mobile problem, if anyone has a question for Ahmed, quickly we can get this answered. If no one has a question, so we'll leave Ahmed for his nice park and nice weather.
Thank you.
He seems enjoying. Good. Okay. So guys, keep the question in the question and answer section, so or the chat, so we can answer them through the session, not to stop after every presentation. So if you have any question, just put it in the chat. Wahab, shall we hand over to you?
Of course.
So guys, Wahab is basically summarizing all the feedback I got from all the candidates, and hopefully this will be a very good and clear insight for you for the experience of maybe 6-7 candidates who passed, who didn't pass, who achieved the number, who didn't get a number. So I think this is one of the most important presentation, because you basically go inside every experience and get a collective advice based on actual experiences. Wahab, over to you.
Thanks, Mr. Hashim, for having me today. So guys, I have prepared this presentation is about the ST3 preparation. My name is Muhammad Wahab. I'm one of the trauma and orthopedic GCFs in Wixom Park Hospital. So I will go through how can you prepare for the ST3 interview. I will go through the self-scoring system, and then I will go through the stations itself. I have collected the feedbacks from other colleagues who managed to get the ST3 numbers this year. So I will speak about the eligibility criteria. So first of all, you have to finish your MPBS or your medical qualifications for sure. If you want to apply in anything, kind of training in the UK, you should have your JMC registrations. You have to finish your MRCS exams, Part A and Part B, by the offer date. And at least you need to have 10 months experience in T&O. And one of the most important criteria that you need to finish your foundation competencies. For those people who had finished the core surgical training, they don't have to provide anything, just kind of evidence that they have finished the core surgical training. But for those people who haven't had the core surgical training in the UK, they still have the opportunity to apply for the ST3. You need to provide your CCRES form. It's about the certificate that you are qualified to enter the high surgical training, and you can get it signed from any of your consultant in your hospital, or you can sign it for your clinical supervisor or your educational supervisor. But guys, make sure that it has been signed by the consultant for each part that need to be signed by the consultant. And for myself, I got a mistake in the last year when I provided my form. I realized that there's a mistake in the date, so they gave me an opportunity to fix it within 2 years, and then I reapplied it again, and then they accepted it. And this is the ways that how can you prepare for the interview. The most important thing that you need to attend most of the online platforms, like the OrthoXcel that running by Mr. Hashim, and the fun ortho sessions that the people that who managed to get the training yesterday, they recommended it. They usually start 3 months before the exams, and as usual, practice and practice and practice with your friends, with your registrars, with your consultant. Try to record yourself and see your performance. Check it again, strengthen your weakness point, and make sure you are working on it. And I mentioned the most common or the most useful courses and online platforms. It's Ortho Revision, Ortho ST3, Ortho Interview, and ST3 Interview. And from the feedbacks from the guys that they went through the interview yesterday, they mentioned clearly that you need to focus on the post guidelines and the NICE guidelines by heart. And of course, your anatomy is very important because you're a surgeon. You need to focus on your anatomy. And the recommendations was from the Netter's orthopedic anatomy. And most of the people, they use Google as a feedback as well to get the cross sections images from Google as well. I will strengthen back again about practice. Practice with your friends is very important. You can start, guys, about like kind of small groups first, and put yourself kind of time to train and to practice again about the questions, and try to get the feedbacks from each other. Involve your registrars early while you are working during the on-call or while you're on the ward. Try to get their experience, how they prepared for the interview. During the exam, try to stay calm, try to gain your information and bring your mind. Take a few seconds to think about that question that has been asked to you, because you need to mention clearly your answer and try to think before you speak. Give yourself some time to gain the information and let the examiner to guide you during the answer. Sometimes because you are under stress that you will direct yourself in a wrong way. So give them the opportunity to redirect you if you are in the wrong way. Um, if you don't know something about the answer, try to ask about it again, ask to repeat the question, and try to think logically. If you are unsure about that question, um, mention that you need to rediscuss it again with a senior colleague or with your consultant, and that will be reflected on you later on. Because that will show that you are safe, a safe doctor, and you are keen on going learning as well. For the timeline for preparation for that interview, you have to start. I will not say that you have to, but it's recommended to start 3 months before the interview. Try to build up your knowledge again. Go through the books, go through the online platforms that I mentioned in my previous slides. And 2 months before the interview, try to focus again in your knowledge building. Try to practice, and practice. Go through the question banks, and 1 month before the interview, try to do mocks with your consultants. Try to arrange time before and during the interview to gain the information that you have studied a lot. Try to intense the group practice sessions that you guys have you carried on before the interview. Try to do mocks by the ortho revision and fun ortho and OrthoXcel. The online platforms are very, very useful for the interview, guys. Don't miss it at all. um, I will go through the timeline about the applications. So guys, you need to prepare yourselves before the time that the application will open. So the applications open in the last year was open in 14th of November, and the application deadline was in 5th of December. The self-assessments evidence upload that you need to upload all the evidences that was in the 2nd of January, and then that deadline was in 13th of January. The interviews was between the 1st and the 4th of April, and then the initial offers released in 15th of April, and then the deadline was in 17th of April. Now I will go through the self-scoring system, which is very important for you guys now to prepare for the interview and for the application, because the application deadline will be in November. Um, I know that you know all of these questions by heart, but I will go through one by one, and then I will mention the tips from the other colleagues that they managed to get the SAT number this year. So the first question is about your um, experience in medicine, and this called the N number. And then for question 5, 6, 7, 8, that will be divided on the N number. I would just need to highlight that because for our, I mean, like we are Egyptians, so we usually start counting the N number 2 years after graduations, because in Egypt we usually have 1 year as internship, and then you have to start counting your experience 1 year after the internship. Um, just to highlight that the gaps are not included in the N number. For question 2, it's about your orthopedic experience. So the maximum point that you can get it from that question is 8, and that the experience should be between the 10 and 42 months. So if you are planning to apply for the next years as backup, you need to make sure that you need to change your specialty and keep your mind open for the other specialties so you can stop your orthopedic experience. Consider that you can go for other jobs like such as the quality improvement fellowships or educational fellowships, so that in this way you will stop your orthopedic experience, and then you'll have time for other specialties as a experience. and also you can get the A score, which is the maximum score for that question. For question 3, it's about the other specialties. So if you have at least 4 months in the following specialties, which is plastics, neurosurgery, or vascular, or ENT, or cardiothoracic surgery, or emergency department, or the ITU, or urology, pediatric surgery, or general surgery, if you have at least 4 months in one specialty, you will get 1 score. If you have at least 4 months in 2 or more than these specialties, you will get 2 scores. And the tips for that question, that you need to provide the HR letter or a consultant letter, or you can provide the front page of the contract, which is including the start and the finish dates. For question number 4, it's about the operations for the hip fractures. And the update for this year, that the numbers of the operation that needed is more than 18. The last year was more than 12. And if you provide the evidence that you have done more than 12 the last year, you will get the maximum score, which is 4. This year they change it, that question, and then you have to provide evidence that you have finished, or you have participated, or you are the main surgeon of the hip surgery. That should be more than 18. You will get 4 points, which is the maximum score. And the tips for that question, that you need to provide your e-logbook or whatever your evidence that need to be signed by your consultant. You need to mention the name and the signature, and you need to mention the GMC number on each page. Don't forget that, because they will not accept your e-logbook at the time. For question number 4 and question number 6, it's about the research experience. Of course, it's better that you provide your research experience during the interview, especially for the portfolio station. During uploading the evidence of research, who is the first author or the co-author, you need to mention the ID for each paper. And then I need just to remind you guys that the maximum score that you can get from question 5 and 6 is 8. For question 7, it's about the presentations, whatever, if it's national or international presentation, you need to provide the certificate of the presentation and the conference program as well. I have mentioned here in my presentation the website, the most common websites that we usually find the conference that will help you a lot. It's the International Conference Alert and Scientex Conference. You can find the running international conferences or the national conferences running over the world. So that will help you a lot, guys, if you have an audit or QIP or a paper that you need to be presented in one of these conferences. That will help you a lot. For question number 8, it's about the audits or quality improvement project. And then again, the maximum score that you can get it from question 8 is 2. And again, that will be divided on your N number. For question 10, it's about involvement in leadership or management. So if you can provide a local or regional leadership, such as organizing event, organizing course in your hospital, or you can manage the rota in your department, you can get 1 score. For myself, I provided a letter from my hospital in Egypt that I have done admin duty outside of my working hours, and that has been accepted. And of course, if you have international management or leadership, that you will get the maximum score, which is 2. You can participate in OrthoXcel, or can you organize a conference, and then you need to apply a letter which is signed by the conference, which side or it can be signed by your consultant again. And guys, for question 10, that is not divided by N number at all, so it's a good opportunity to get the maximum score for that question. I missed question 9, which is about the higher degree or the equivalent. So guys, because most of the residents from Egypt, they have done the masters before coming to the UK, so that you will get that will be an easy 1 point, so you can get it. And again, that is not divided in your in number. For question 11, that is about the teaching experience. So if you can provide evidence that you have done formal teaching in the last 2 years, especially at least 4 sessions per year, that you will get 1 point for that. And if you manage to get a PG certificate or PG diploma, you will get the highest score, which is 2. And again, if you manage to get that question, because that is not divided by the n number. For the last year, the question number 12, that was updated question. It's about if you manage to upload your evidence in organized manner or an organized way, that you will get the maximum score, which is 2, and that was very, very easy, 2 points that you can get it. For myself, I provided a Word, a sheet, and then I mentioned the question, and then I mentioned my evidence as well. I attached my evidence, so I put it in very organized way, and that was very, very easy, 2 points to get it. And again, the tips for the self-scoring assessment, you need to start to prepare it from now. Try to save each question separately. Have a look to the other portfolios from your colleagues that they managed to get the ST3 number. Um, and again, it's about your portfolio. So try to do it by your own way and practice, practice, and practice for sure. So now I will go through the 4 stations. I managed to get the feedbacks from the people who managed to get the ST3 number. So from the feedbacks about the portfolio, I mean, the examiners, they mentioned in their comments that you need to be focused on the structure of the answer. You need to summarize at the end of your answer as well. Uh, they mentioned that clearly that candidate, he managed to understand the clinical governance and the duty of candor. Um, and again, you need to put the backup of your answer with evidence for sure. Because anyway, you have provided your e-logbook and your portfolio and the scoring system. And again, the portfolio, it's the opportunity for you guys to sell yourselves and show that you are confident, not arrogant, show that you can get the ST3 number by selling yourself. And again, for the portfolio, because you need to be on time as well, try to practice and practice and practice. And it's better to do it in Zoom meeting or Microsoft Teams, because the exam it's not face to face, it's online exam. So it's better to practice from early point with your friends, with your registrars, with your colleagues that they are applying for the training with you as well. That part of the portfolio, from the tips from our colleagues that they managed to get the numbers last year, they said you need to get a template for exactly the first open question, which is about talk about your CV or talk about yourself. Why do you want to do orthopedics? It's about the structures. I think Ahmad Ashur, he mentioned it in his presentation as well. It's about the camp clinical. You need to mention your clinical experience. You need to mention the academic experience, management, and your personal structure as well. Um, Again, you need to mention your background, your research and audits, your teaching experience, your leadership and management experience, and even if you manage to get other activities outside medicine, you need to mention it. Some people, they use the chat GPT, and then they had a very good experience with the GPT. They managed to get like concise answer and focused answer for the portfolio questions. And again, it's about the practice. Try to get the feedbacks from your registrars, from your colleagues, from your consultant. Work on yourself and focus on your portfolio. For the clinical stations, from the feedback from the examiners, they mention clearly in their feedback about the ATLS and CCRES protocol. Try to make sure that you know the 2 protocols by heart. Um, use the courses and the online platforms like Ortho Revision, Ortho ST3, and Ortho Interview and ST3 Interview. And again, it's about the guidelines. You need to focus in your answer about the post guidelines and NICE guidelines and try to highlight it in your answer. For the anatomy revision, most of our colleagues, they revise the anatomy from the MRCS. They recommend the Netter Kunzes orthopedic anatomy as well. They used Google to get the cross sections images as well. Try in your answer to be safe and escalate it to a senior if you are stuck in your answer, and try to show your communication skill as well during the exam. From the feedbacks and the tips about the feedback, try to mention the surgical approach if it's possible. Try to focus on the classifications. I mean, like, and in the feedback, they mentioned that that candidate, he was aware about the classifications, and then they highlighted in their feedbacks. Don't forget your anatomy at all, and try to be aware about the deforming forces when you describe the x-rays. Try to mention it in your answer, because in that way you will get the high score for the answer. For the prioritization, it's about two ways that you can be asked the question. It's about the trauma cases, or you can do prioritization for the on-call patients. um, Again, from the colleagues who managed to get the SC3 number, they try to put a structure for the answer. And then the key success for this station was practice, 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 and record yourself. The last year, the prioritization, I think it was, the list was composed more than 12 patients. So that was very challengeable because you need to finish by time. It's about that structure that you usually use in your answer. It's about the hospital. You need to know that is it major trauma center or this local hospital, so you can cancel the cases, or you can think about the case that you can deal in your hospital. Try to ask about the resources that you have, especially that if the SIPO is available, or just you have the trauma theater. Try to ask about your consultant specialty to make sure that that he can deal with all of the cases that provided in your list. Ask about the patient stability. Ask about the type of the injury. Make sure that you excluded the neurovascular damage. Ask about if it's open fracture or closed fracture. Mention the other injuries that was very, very important. And again, try to mention the ATLS and the CCREST protocols in your answer. For the on-call patients, the highlights from their answer that they tried to use the SHO to help them during the on-call. And again, try to prioritize these patients according to the emergency, according to stability. And again, try to use your SHO. For example, they can ask you about uh, is a patient in the ward who is unwell, and then you can send your SHO to deal with. And then there is another patient coming with suspicion of the compartment syndrome, so that will need priority. So we can see that patient first. And then you can, another case coming with a fracture ankle dislocation that can be reduced by the ED team, so they can do it, and then they can send you the X-rays after. So this the way how can you deal with the prioritization of the patient coming during the on-calls. And again, it's about the communications. I know the last that station was quite challenged in the last year. I try to collect the feedbacks from those people who managed to get the ST3 number. It's about the practice and practice and practice again. Try to understand the criteria, try to know your technical knowledge, be aware about the situation, and try to get the practice scenarios as early as possible. Engage in the mock interviews or role plays scenarios. Um, Involve the patient in your answer and in your communication. That will be included in the breaking bad news. Explain the procedure in a way that the patient can understand. Try not to mention the medical terms too much in your answer. And again, try to get the feedbacks from your monitor, from your registrars, from your colleagues who are practicing with you as well. I tried to get the tips about how can you get the high score from the communication station that has been mentioned in the feedbacks, that you need to be active listener, pay attention to the scenario, try to listen actively because that will guide you to the correct answer. Show empathy in your answer as well, especially for the breaking bad news. Try to be clear in your explanation, and again try to avoid the medical term when you are explaining the diagnosis to the patient so he can understand. And again, try to show the body language, and because the exam is online, and then you need to ensure your body language is covering your confidence, and try to maintain your eye contact with the examiners as well. Thank you very much for having me. I'm very happy to answer any questions.
Thanks, Mo. It's a very good presentation. So beyond my expectations, so that's good. So we have Rami and Ziad, and no, Faris is not there. Rami and Ziad. So who prefer to start? So Islam is managing the answers on the chat. So I think all questions are answerable. So nothing specific. So who is ready?
I'm ready if it's okay, because I'll have connection problem in a little bit.
Don't worry. Go ahead.
I'm hoping. Can you hear me wrong?
We hear you, yeah.
Because
No, we hear you.
okay, wonderful. So sorry, I didn't have a presentation prepped for this, but I would just like to introduce myself a little bit. So my name is Rami. I was a medical university graduate from 2019, Beni Suef University. Worked in Sheikh Zayed University Hospital and started off, and then in 2023 worked here in Broomfield Hospital, which is in Essex, as an SHO. And several months after that, I got a registrar job at the hospital, which I still do at the moment. Last year was my first attempt at applying for ST3 interview, which has been my plan since I was in Egypt. I thought I had very good prep, so it was on my mind. I was doing really well. And a lot of the things that I did with the guidance of everyone, as well as this group, had worked well in my favor. But there was a lot of things that I picked up on that basically were the reason that I didn't make the cutoff point. So there's a lot of advice you guys can get, and a lot of it is helpful. But I think what I've found reflecting back on this experience is a huge chunk of it is tailored to who you are. So listen to the generic advice you get from everyone, but make sure that you're tailoring some of that advice particularly to you. Because after this, I've had several discussions with my more senior registrars as well as the consultants, some of which also conduct interviews. And I've come to realize that the reasons I lost these points were for very valid reasons. So, which is what I wanted to highlight today. So, if I'm and if you have any questions, just discuss. So I would like to start off with how the whole interview and they will send to each station, and what my experience was. So they gave us a specific time point. I was on the first day out of the 4 days. So it was from April 1st to April 4th. Unfortunately, I was on call that day when they sent out the invites, and I decided to reply to the email when I get back home. And by that point, I didn't have really any choice in which day I pick. I only had slots remaining for the first day, which was a day I was working, which was a little bit of a struggle. So certainly make sure that you've got all of those days sorted out and off before you apply. So I knew it was going to be from April 1st to April 4th. I tried to sort out most of the days off. But if you can do that, because one of them was an on-call, maybe you'd need to sort out a swap. Just make sure that that is all sorted out so there's no stress about it before the interview. In terms of how it is experiencing going first day, second, third, or fourth, I don't have experience because this was my first shot. It was the first day. I don't know if it's any advisable to take another slot, maybe later, morning, afternoon. But my experience is I was first day afternoon session around 3:30 p.m. And at 3, they first off would log in, they get to see us, identify us with like passport or whatever you're using as identity proof. And then they give you 30 minutes off and they tell you you're going to start off on that minute. For me, it was 3:30. I logged in back again at 3:30. So I had a 30-minute break, cameras off, had something to drink, relax a little bit and prep for it. And then I logged back in at 3:30. In 5 minutes time, they said there's going to be a little bit of a delay. 3:35 exactly, we started off my interview. So each station is 10 minutes and you swap between stations, but they give you a 5-minute prep, I believe, from what I recall, before each station. And the beauty of it in a lot of the stations was you get the clinical information that you're going to be asked about for at least the first half of that station, if not the full station. So first I got asked about my commitment to specialty. So that was my first station, and I think I had a little bit of a hint beforehand, but when they started off, the time starts immediately once you get swapped into that room. Okay, so you get those 10 minutes. In that station, there's typically should be about 3 people presenting. Sometimes there can be an extra person who is an invigilator or someone who's just monitoring the overall process. And the way that worked out for me for that first station was the examiner introduced pretty much all of them, so all 4 of them. And that took about 1 minute and 15 seconds of my time. And then they went straight to ask me about my commitment to specialty stuff. So that little bit took a little bit of time. So when you're prepping, make sure that you're not just doing it for a full 5-minute prep or 10-minute prep. Make sure you're hitting your numbers quite quicker, because I ran out of time and that happened in quite a lot of the sessions. And it's something that I definitely need to work on, and I'll give you advice about that. They started off asking about, my overall clinical experience or just general experience. Tell us about yourself. And we know that this is a very commonly asked question. You need to have it prepped. You need to have a structure to it. And I would say for every single station, my number one advice would be structure, structure, structure. 100%. Okay. And they get to see all of us. They see hundreds of candidates over the whole 4 days, 4 years. They want to filter out people who actually know the system and well structured and come across quite well and well presented. And when I structured my answer according to CAMP, which is a very commonly used structure we use, my primary focus in my interview was I was asked a lot about my clinical experience rather than pretty much everything else. Because I was a junior trainee in Egypt. I came here as an SHO, became a registrar, all within like a very short time. And they wanted to focus on my numbers. They asked about, how many index procedures I had, how many I had filled out. And it's a little bit unusual. They didn't care much about the academic bit in my exam. And the feedback for that was quite well. So make sure you're very familiar with the ISCP, with your index procedures, and kind of carry yourself as, you're one of the registrars or that you're familiar with the system. But certainly go through your whole CAMP structure, which is going to be well, asked about. Then the continuation of that part of the interview was for the first 5 minutes, they had to ask a little bit more about kind of your portfolio. And they asked me about a specific audit or research that I've done. And one of the ones that I mentioned, I was just finishing the second loop for, and I got that as a comment on my feedback. So certainly if something you've worked on and you've done as a second loop as well, that seems to come across as a good point, rather than just mentioning I've done 3 or 4 audits and I've assisted in that and all of that. Make sure your answer for that bit is well structured. And for the other part of that commitment to specialty, they have a few minutes to ask you about something else. So in the first day, our question was related to a colleague registrar who's had a consultant speak to him in a rude way, and how would you approach that? Now, I wasn't very familiar with the structure to approaching these questions, but I stuck to the structure that I knew about escalation, and I went along with it. And then I got to the point where they asked about what guidelines do you know about that specific sort of complaint procedure. Of course, I've highlighted, safety of our patients comes first, and I would like to ensure that everything is well handed off from my colleagues' perspective and their clinical tasks. But when I got asked about official guidelines or advice, I said I had no idea. And there is the GMC Clinical Code of Conduct, which is something they were very looking forward for me to answer. I just wasn't familiar with it. And to be honest, I just said that. So things like that seems like a little bit off from, the typical things you prep for, right? I've done a lot of prep for the clinical side of things. I'm very familiar with how most of the questions come across, and I prepped for it, but this was something that I unfortunately didn't have any experience with, and I lost points for it. So, these more finer kind of deep like questions or things that we may ignore, pretty much you need to focus on it, and you get marked on it completely as a full station, just like everything else. So make sure you're not kind of ignoring these bits, and put as much effort into it as you can in your prep. Finished that station, I ran out of time, and I got deducted a lot of points across all the marking points in my feedback in that station, because I ran out of time, and I came across quite laid back is one thing that I got. I was very confident with my answers, but still, I think they were looking for a more eager, more engaged kind of answer. And this structure is something I definitely could have worked on. I got marked quite low on that particular station. I got 31 out of 50, which I think just was quite low, but I understand that there's a lot of bits I could have worked on. So get a very good structure for all your answers. Work really hard on making sure you're hitting all those, buzzwords, hitting just exactly what they want to listen to, and continue with your structure. And even if something is your answer that you're not familiar with, you should come across quite well. The second one was the clinical station. Clinical station, you get 2 5-minute bits in the station, and it's 2 clinical scenarios. You get the first one on the screen for that 5-minute prep beforehand. So for the first 5 minutes, you have quite a lot of time to think in your mind what the station is, what they're expected to ask you. And you can see that, as mentioned by my colleagues, a lot of resources are out there. And I found that they were very, very adequate when it comes to clinical bit. I absolutely loved it. So I think I used Ortho ST3 interview for the clinical bit, and I think the other one was, I'm not sure if it was Ortho Review or another one, but for clinical, those are very, very well. I feel like maybe for the other stations, they weren't that adequate with the other courses. but structure remains the same. So clinical, 2 stations, 5 minutes each. You get asked quite a lot of questions. Anatomy is always going to be as part of every station that you go through your clinical bits. You should never lose points on that, okay? As long as you've prepped really well for your anatomy, and there is very limited imagination that they can put into the questions to the point where it can be a very tricky question. I thought clinical station was the most straightforward one. It was still difficult, but it is one that you can definitely prep really, really well for. And as much as you prep and you work hard on it, and if you've been doing this for quite a bit of time and you're familiar with the structure, you should be hitting quite high marks when it comes to clinical. But they mark you quite well on your knowledge, on your structure, how you come across. So your prep will make a huge difference when it comes to scoring really high on that. And I think I did well on that. Excuse me. So the clinical, I think, is one that you just need to practice a lot. And as my colleague said, that you're prepping with other people, candidates, and starting maybe about 3 months of the interview period. So let's say from the New Year's time, or even in December this year, you should have adequate enough time to be very, very well prepped for that. The prioritization station was my third station, and you also get a little bit of a hint beforehand, and you get the whole list, which I was very surprised by before we started, right? So you get all the info, you get all the data, and you got 5 minutes. So you need to have a very well structured to approaching this, and it's a little bit more time consuming to go about how to approach it, what you should be looking for. And I've done a lot of prep for this, not as much as I should have, and I realize that now. And we got 12 patients on 2 lists that was being presented. My feedback was I got really well structured and went through every single case, and I didn't miss anything. But going through it, and I had a very good approach. I thought there would be something more, complex or underlying, or there would be an issue I'm missing out on. So I really went into a lot of details for each one of the cases before I went to my final list ordering. And unfortunately, I ran out of time, and I was aware of it, but there wasn't anything complex about any of the cases. It was very straightforward, typical day in the life. Getting those 12 cases, I think, was probably more, usual and like a chill kind of list than most of the daily lists that we come across that we have to prep for. So I was very concerned that they may be looking for something that wasn't put in the points and they wanted us to pick up on. I think I overthought this station a lot. If I had just stuck to the structure as usual, gone through it, making sure you're missing no one that is latex allergic, the MRSA positive patients, your patients in beds or not, making sure that your patients have been starved, there's no open fractures, and there's no one with neurovascular compromise. You know which consultant and which registrar is in each list, and they actually provided all of that information in that 5-minute before even starting kind of brief, right? It was a very long page. I remember that one, but they had pretty much all the details you can extract out of the patients. I've asked all the questions I could ask. There was nothing else hidden, which is a little bit unusual from what we prep for, but a lot of the stations we prep for are more like either one, if you hear from the candidates, maybe 2-3 years ago, is 1 station, 5 candidates. Maybe they bumped it off a little bit more, or sometimes they ask you about patients being seen in ED after handover. How would you structure that? Or a mix between referrals and new patients you're seeing and list ordering for the next day. So when it came to this station, I would say the major thing that is very important that you have is your structure and time management. And while my structure was quite decent, my time management for managing 12 cases and presenting it and list orders was unfortunately not adequate, and I ran out of time. The 10 minutes finished when I was going through my second list. I needed probably another maybe 30 seconds, 40 seconds. But the feedback, because I missed that, was I got marked less on each point of their criteria for scoring you. So decision making, the other bits, the planning and if I'm organized and stuff like that. So they didn't just take 1 or 2 points because they ran out of time. They actually took maybe a couple of points at each one of them because it is quite valid, right? I didn't finish the station. So I lost quite a few points there. I think I marked maybe 37 on that station. Last one was the communication station, which has been a new station they introduced, I believe, last year, and the year before. And there's a lot of guidance out there and a lot of different ways that they can run the scenario. There was some belief that it could be a role play kind of scenario, but the years previous in my year, it wasn't. So they give you a certain scenario and ask you, what would you do about it? But there can always be the potential that they could put an actor or one of the examiners could act as if they're a patient and give you a scenario from their perspective. I thought there wasn't a lot of material on prepping for this station, and because of that, I think a lot of the points were based on how candidates come across something that they're not familiar with. I don't think they were very harsh with their grading with this station. But like I said, it's just also you have to be very well prepped with your structure. And if you do that and familiar with certain sort of environment and questions that they asked about, you should be able to come into it much well prepped than other candidates. The scenario I got was basically a near miss or a never event type of scenario. You need to be very familiar with these terms. You need to put it up there as a buzzword straight away, and you need to highlight how to manage it, and you need to know the guidance behind it as well. I wasn't quite familiar with it, and it took me quite a bit of time to say that this should be a never event. My answer was quite late, but it presented as first, it was 2 parts. First scenario was you're going in, you're scrubbed in with your consultant, you're doing a primary total hip replacement. He asked you to descrub and do the op note, and he's going to close the wound. And as you go to do the op note, you check and you have a look at the stickers and you find that there's a mismatch. And they don't mention mismatch. They give you numbers about the head size and, the polyliner or your acetabular cup. So the first point of marking, which I got on the feedback, was that you identify what the problem is, right? So you need to say very early on, I'm worried about that there's a mismatch between these two components, right? And why you think that is a problem, right? And then the next follow-up question, this was one of the stations where I got prompted quite a bit because I didn't know how the station is going to go. So I would mention what I said, and then they would ask me, so what were you going to do now, right? Whereas with most of the other stations, you already know what the follow-up is going to be, and you kind of want to lead them. You want to have very minimal prompting when it comes to going through these stations, right? They've gone through a lot of candidates. They want to hear someone who's very fluent, very fluid with this answer, and just giving it 1, 2, 3 point with a very well structured. After that, mentioned, go check back with the consultant immediately and check if he's in theaters, if he's closed the wound. If not, then this is something that we can revise on the table and, the options. And you have to mention duty of candor. But, if patient is still asleep, you want to be actually giving advice about what the next steps are at that point. And then mentioning, as per duty of candor, you explain everything to the patient post-operatively. Once I've finished that, they flip the scenario to where, okay, you go back to your consultant, but he's finished up patient's gone back to recovery. How would you approach that? And you have to approach this from two ways, right? You have to think about informing the patient about what happened. You know, this is a never event. You shouldn't have mismatched components. And that, you know, you explain as per duty of candor the mistake that's happened and what you can do about it, right? Involve your anesthetist very early on. Make sure if the patient can come back into theaters same day, or if, you know, check clinical examination, has the hip dislocators come out, is the patient stable, and manage it from that kind of approach, like patient-centric approach. As well as with the rest of the MDT, you need to highlight certain things if you're going to date exit, if you're going to put a formal report in. And I got asked further questions about, you know, how would you escalate a never event? And I'm only familiar with what we would do as local protocol, but apparently there's more guidance to it. So maybe look into that. I will certainly do that as well. And, you know, see how this should be escalated properly. After that, I got asked a few questions about what would you do about the rest of the list? And I think that question was led toward first was do you in terms if you take the patient back to theaters, you have still sufficient time to go on with the level of accommodation to feed them. We can't just anymore. It was an elective based scenario. So things have to plan that you know you're never going to get to by the end of your list, right? I finished this station probably minute 8 mark. I've gone through all the questions. So time wasn't a particular issue. I felt like probably the remark scheme had a few question lists that was quite limited. They were happy with the station. Of course, I'm just wondering, right? This is the first I've done this, and I haven't really had much experience before that, but collectively looking at everything, how I came across and how I got marked, I got in the end a score of 174 overall. And my application also, but I was N number 1 at the time, so I wasn't losing a lot of points in portfolio yet. And I think the cutoff was for first round was 188. And then for the subsequent like new offers and rounds, it was maybe a 3-4 points lower than that. So it might seem that maybe it's just 10, 12, 13 points off, but literally every single one of those points count, and they make a huge difference in ranking. In order for you to be eligible and in order for you to be competitive and get within the, you know, top for us 137 candidates that got offered their first like job in the first round, you need to really work on hammering through every single point, right? It's not something that I think maybe my approach was you can get decent points in a lot of the stations, you'll be fine. I think each one of these stations needed to be approached with sufficient effort and focus, right? So we work typically a lot on the clinical bit because it's something we're familiar with and we know how to work really hard on, but all the other stations are just as important and you need to be really, really focused on that. So my advice is stick to structure, learn quite a lot about just finding out how each station should be approached, practice a lot, have your answers ready, even print them out, write them, use some other like advice on ChatGPT is a good idea, maybe other successful candidates, templates to help you with structuring your answers, and just go through each one of those stations and make sure that for all the questions that potentially could be asked, that you have a very well structured answer and you go through each one of them and you're well prepped for it. Because on the day, I think the interview process and everything was very smooth. It was a lovely experience, but the results and marking bit didn't really reflect that, right? So there's a lot that I think every single candidate can work on. I've reflected a lot on this experience, and I know what I really need to work hard on. And time management is a very important bit. I think I've proved that I have an issue with that because I probably went quite a lot with my presentation today. But it's just I think one of those things that really did make a significant difference that I can see on my results. Really work hard on it. I think with very good prep, we should have a very good chance of passing this and getting a good score. So I think for me, that was my limiting step. For other people, it may be something else. So take everyone's advice and just focus really on what your weak points are on and hammer that with practice, practice, practice. Okay, that's the conclusion of my presentation. I'm happy to answer any question at any point.
Thank you so much, Rami. Really, really insightful and informative. Very good. And it's not about the presentation or not. It's very good they remember every station, what happened inside. That's all what I think the candidates needs. They need to know your experience. What did you find right? What did you find wrong? What you will do differently if you are in this place? But fortunately, you will not. You already, you already secured your number. Well done, and thanks for your time.
Okay.
I don't have any question in the chat, but if any question, I will let you know. Ziad, are you ready?
Yes, I'm ready.
Yeah, please.
I'm happy to share my screen. Just have a quick presentation. We'll try to make it a quick and casual
Go for it.
presentation. Let's see what can we share. Okay. So let's try that. Is everyone able to see my screen?
Yes, we do.
Yeah, perfect. Okay. Just a second. Struggling here. There we go. Yeah, so essentially, I'll just give a quick talk about the presentation. It's mainly just listening to what's being said. I hope everyone's still focused, and then I'll show you a quick run through about how to approach each station, my preparation, what I've learned, and how can I make use of it for the future. So essentially, I've prepared for this interview for around 3 months, maybe slightly less than 3 months, which I believed was quite a fair time. And looking back, I think I would have given it probably an extra month just to essentially make sure that I'm having more practice. Although I feel I've practiced enough, I've taken enough mocks, I've reached to enough colleagues in order to prepare for this interview and give it much more than what I could have given it. I feel I've given it enough, but looking back, I could have given it a bit more because you need to give lots of respect and consideration for this interview. It's a very important interview. Every mark counts, even your self-assessment marks. Whoever tells you that as soon as you're done, you're shortlisted and you got the interview, that it's a fair ground, it's not really the case. Every point counts. One mark can make you jump almost up to 7 and 10 places, which is something that looking back, I would have tried to work a bit more on my self-assessment score, although I got quite a good score in it of around 24 or 25, and that was still not enough to secure me a number. So I've ranked around 170 and they're only taken 154. So please give it all the importance and consideration that it needs. So essentially, my colleagues have spoken perfectly about a lot of these pointers. Make sure you start preparing for your paperwork from now, all your portfolio papers. If you look at your portfolio, see what marks you are missing. Especially most of us, the highest proportion were lacking in research, higher degrees, and probably audits. Make sure you try to excel in those and try to reach the highest marks possible, even if you can get full marks, so that when you apply, there is absolutely no doubt that you're getting an interview. And once you have an interview in your hand, it's yours to lose. You have to make sure that you destroy the interview. There is no other chance because everything matters. And when I say everything, your self-assessment scores, how you present yourself, how you speak, your accent, your tone, how you signpost, how you show them confidence through eye contact, gestures, all of that. There are some unfair things that can happen in the interview, and you might sometimes be surprised with your feedback scores. And there is absolutely no other explanation of what might be the reason. But you have to know that you have to make use of everything that you have to. And it's unfortunate that you have to probably work probably 2 to 3 times a bit harder than other candidates who might have a slight advantage. But you can get it, you can earn it, you just have to work hard for it. Okay, so the interview structure is 4 stations. Each one of them is 10 minutes each. You do have enough time before each station to go in, read the scenario, calm down, have a drink, formulate your answer, and make sure you just regurgitate everything that you practiced. If you don't practice well enough with enough number of people, especially with people who give you honest and heavy criticism, feedback, not just telling you your positive bits. Make sure you tell everyone you practice with, please tell me what I need to improve on. Because from all the 500 mocks that I've done and the courses I've attended and the money that I've paid and invested in, most of the courses, honestly, they were like, they only say the good stuff. I had to make sure that I tell them, please don't tell me that, yeah, I think you did well, this, and that. Tell me exactly what I'm weak in, because if you just um accept that reality, once you go to the interview, you will realize that you're competing with other people who have honestly invested so much on their on them improving and not really caring for what they're good at, rather improving what they know will give them the edge. So find the important things, the gaps that will make you stand out. Okay, so clinical commitment to specialty, which is portfolio prioritization and communication. Make sure you practice for each one the same amount of dedication. Just don't say because I'm good in clinical, because I have 10, 20 plus years of experience in my specialty, that I'm just going to leave it. And most of the interviewers and the people in the interviewing panel have said that the portfolio station is the least station that candidates prepare for. And this is the station where most candidates lose their marks because they didn't give it the importance that it needs. Most candidates, although score highly on their clinical and prioritization stations, and they lag behind in things which are very subjective, including the portfolio and the communication station. Okay. This is an update from our current 2026 application in regards to specifically question number 4, which I think one of my colleagues highlighted, which is related to the number of neck of femurs that you do. Last year, it was around 12 procedures. Now it has gone up to getting full marks to 18 or more. So please take note that this year it's different. And this is also something that you can improve on from now. Look at your portfolio and make sure you're ticking the right boxes and you have consultant feedback and register it in your ICP so that it helps you later on in case you, God forbid, don't get into training, that you can progress in other routes or even if you apply again. Okay, keep an eye on the website. The forms are released a month in advance before the application, and make sure you download it, memorize it, as my colleague Ahmed Ashur said. Make sure everything is read very well, and make sure that you apply the appropriate evidence, as we mentioned here. So again, the evidences last year, a lot of people lost marks, a lot of people appealed, some people got their marks, some people didn't. If you feel there is something that you need to appeal for it. You will not lose anything. There is nothing to lose. If anything, you will be gaining marks. And again, every single mark matters, can make you jump from 5 to 10 seats once you're done with your interview. So rather than regretting it later. And last year, the cutoff significantly increased compared to the years before. So in 2024, it was 17, which is quite a decent score, very easy to achieve. But last year it was 22. I know people who've got 21, 21 and a few decimals, and they didn't make it. And it's very heartbreaking because they never expected this to happen. So make sure you just try to fill your portfolio self-assessment to the highest points possible. And believe me, it does make a difference when you see your rank at the end. And these are the things that really matter to me. that I could have added 1 or 2 points or appealed for something that could have helped me. It could have made me jump into possibly getting a seat. Portfolio preparation, make sure you have your portfolios ready. Shortlisting, as I said, everything matters. Evidence upload, make sure you root through the evidence document and make sure you're uploading the appropriate evidence. Ask around if there is something you're not sure of. So for example, the logbooks, make sure it's signed and stamped and the consultant's GMC number is written in every single page. If there is one page that's not present, you've lost all your points. So it's a very silly mistake and it's going to cost you an interview and costs you trying to find a job to maintain your end score. And it's a big headache that I'm going through right now in order to try to maintain my end score so that I have an opportunity to apply again. And I really don't wish it for anyone. So please make sure that this is something that you prepare for in advance. Key resources, your resources are your guide and your mocks and the courses that you take are your guide. Do not try to recreate a schedule that does not make sense. Ortho Revision, I'm not sponsored, but Ortho Revision honestly just paved the way for me to help me know how to approach every single station. What are the important bits to focus on? What are the examiners looking for? So it just gives you the magic cards rather than just fumbling and opening 10,000 books and just wasting your time. Ortho Revision, Dr. Rishi's course is also very good, which I think is, can't remember the name of it, but my colleague significantly recommended it and is quite a diligent instructor and honestly tells you the important bits for the interview and maybe also orthopedic ST3 interviews, which do very good mocks in order to help improve your scores. Take as many mocks as you can. I know it costs money, but you would rather invest your money in something that's going to secure you for the next 6 years and just gives you peace and stability rather than hesitating. I know it's not always easy for anyone, but that's always something you can negotiate with your trust. And you can always make sure you have a good connection and a good circle of contacts so that if anyone else attends other contract, you can split the cost, you can share resources. So make sure you have a good support system. It's going to take you up several notches once you go to your interview that you feel you have everything that you need. And thankfully, that's something, the positive thing that I've had that I would want to share and honestly made a huge difference for me, given this is my first attempt securing that rank. Make sure you have a study group. Do not go beyond 3 to 4 people, but also have 1 person or 2 maximum, which are more diligent and more punctual with practice, because there is many other people going through and a lot of other things, and you will find yourself put in a position where I'm not able to practice today because my partner is not available. So always have a good connection of people in order to practice with and limit it to maximum 3 or 4 so that you don't feel your schedule is packed given your personal and clinical commitments as well. Consultant mocks. I'm sorry I've put it before last, but if I had to, I would put it first and I would write it 500 times. Consultant mocks are probably the most beneficial point that you can do going before your interview for as many times as you want, especially consultants who are in the interviewing panel, and they will let you know, they will not shy away. And it's nothing that harms them when they go for their interviews. There will come a point where they will tell you, sorry, I cannot do any practice because I'm going to be in the interview panel in a month, so I'm not allowed to do any consultant mocks. Consultant mocks, make sure you practice with current trainees, especially the fresh ones, and also especially the ones who've done the interview more than once. We have a lot of very, very experienced colleagues in this session who have given me great advice and have taken me to a whole different level just because they've done the interview several times, and that saved me a lot of time. Of course, ChatGPT, which we all use, is very important. It just helps put a good format to your answers, but always make sure that you humanize it according to how you want to present your answer. So these are my final remarks. Every mark counts. The playing field is not the same. If your self-assessment marks are different, cutoff marks significantly increased. Respect the competition and the preparation. Give it as much time as you can. Start early with a few building blocks, and then around 2 to 3 months before the interview, this is where you need to get the wheel turning and try to get in that zone. Take time off, annual leave or study leave, decent amount of time, I would say a week before your interview, so that you have a good sleep schedule and you have a good nutrition schedule. Take into regard to religious holidays. Our interviews were in Ramadan, definitely something that would definitely play a big role. Make sure as well that you sleep well before your interview. And also that you don't just come after a very long on-call or have your interview during an on-call, or you felt like you haven't taken enough time. It definitely plays a very, very big role. I'm sure my colleagues have seen this. The people in the session, please, this is a very important table, and it honestly just gives you the magic cards of exactly what the examiners are looking for. And every single answer that you give while you're practicing, use that, send your colleague who is examining you that form, blank it out, and let them use it to put your marks down for you. Okay. These are general tips. Booking factors, which day should you go for? Also, as my colleague said, this is my first attempt, but there are some rumors that some days are better than others, some times are better than others, but you can't really throw all your eggs in that basket. But what's really important, as soon as you see that email, please book your slot. I as well probably was late by an hour because I took a nap, which I don't know why. But essentially, please, as soon as you see that email, make sure you book the day that works for you, because every single slot makes a difference. The examiners hear your answer at least 50 times, the exact same answer from 50 candidates that they interview every single day. So that's also that you have to take into consideration whether I should go first, whether I should go at the end. And sometimes the same examiners stay for the whole day. Some of them do not rotate. That's one thing. The other thing is that make sure that in a time that works for you, according to when you feel your body clock is ideal. If you're not a morning person, please don't go for the morning. If you're a morning person, go for it, and vice versa. Make sure that you're dressed well, that you slept well, ate well. Make sure that you wake up in advance before your interview, not just like an hour or two, so that your body has freshened up and your brain is well and fresh, so that you perform at the best time of your interview. Lighting, make sure you choose a corner in your place, which for example, something that I face is that I did have a glass at the top of the ceiling, and my interview was at around 3, so it was around sunset time. I never realized that the sun sets literally in front of that glass, and the whole background behind of me was black because the sun was directly hitting on the camera and I wasn't showing. And I realized that later on. Thankfully, it did not affect me, but any other examiner, subjectiveness plays a very big role in your marks. Some examiners can just judge you for how you look like, for how you speak, for your environment. So make sure that it is just standardized and in the best conditions possible, so that these small things that are around you, the confounding factors, are completely taken off and it's just you and your camera screen. Okay. Now this is a quick, sorry, how do I open this? So yeah. So this is a quick document that I've made, me and my colleague that I was practicing with, about how to approach each station. It gives you an idea about the general flow, so that you don't just feel that with every single course, with every single mock, with every single partner that you practice with, you just don't have a structure and you do not have you do not have an idea of how the interview is going to progress, because the format does not change and your structure of answering should not change. You've probably heard the word structure at least 25 times in this session, and honestly, it is the most important thing. Stick to your structure. It definitely takes you to a whole different level and gives an impression to the examiner that you have an organized way of answering. You know how to signpost things. You escalate as appropriate. You signpost your concerns and act appropriately. And you're aware about all the legal things related to GMC standards, related to the guidelines, the BOS guidelines, and any other guidelines or any other trials that you know. These are just bonus things that will take you to a higher level. So the clinical station will just skim through them really quick. It always starts either with a scenario or with an X-ray. And there is a structure that you have to follow, which is essentially talking about the radiograph, what do you see, AP lateral, in detail, comment on every single thing you see. And many of times you will see left, right, you will see WB, weight bearing, sometimes you'll see patient demographics. These are all, every single thing on that radiograph is important, because sometimes they are showing you something which is different than what's in the case. So that's something that you have to mention, and it's for marks. Not anything that they put there has no meaning. Everything has a meaning and guides you towards the marks. Then you mention your key concerns. For example, it's an open injury, open fracture. So you mention, okay, possibly high mechanism of injury, so ATLS, open fracture, so BOST. What do you need to do? urgently, make sure the patient is stable, make sure that you don't need to activate a major hemorrhage protocol. And I can go on and on with several scenarios. The courses will give you the exact format of how to answer these questions, and it's from the courses that I have mentioned to you earlier. Then you have to talk about history, ample history, relevant history, not just the head to toe history, which is irrelevant. Examination, mentioning your key concerns first, which are relevant to the guidelines that you want to use, whether BOST, whether any other guideline that you need to use, and manage as appropriate according to the BOST guidelines. And this is the same for every single thing that you need to prepare for. If you start your preparation for the interview with the clinical station, you have fulfilled 75% of your preparation. The rest of the 25 is all personal stuff related to the portfolio, the camp structures, some of the communication stations. Because of the clinical station, it covers all the anatomy, all the clinical scenarios, which will help you answering and preparing much quicker for your prioritization and even some in your communication and your portfolio stations as well. Now for the prioritization, as my colleague mentioned, this was the first year. There was the double numbers of cases that you needed to prep for your interview. But the good thing is, which we weren't aware of, and looking back, what I would have done better is that you have 5 minutes before going into that station, and they show you the table right in front with all the 13 cases, who's at home, who has significant injuries, who has, for example, neck of femur fractures. So the way my colleagues who did the interview, who are going to do the interview in the future, what I would advise them, use those 5 minutes to your benefits, have a look at the table and pack each, like segment each injury on its own. So I had, for example, 5 neck of femurs. So you can put them all together as one and tell the examiner that I can see that there is, for example, 5 neck of femurs. I want to ask about their significant questions that you will get to know as you prepare your courses. The best way to approach a prioritization station, for each station, think, I need to ask questions about their history, quick questions about the examination findings, and say, what management do I need to do? For the prioritization, it's just a talking game. The way you talk and the way you structure, it's all points. Do not expect the examiners to ask you questions, because that means this is prompting for them and you will be marked down. So with the prioritization, these 5 minutes, have a sheet of paper empty. If you have a pen and paper, write it now. Sheet of paper empty. Put CPOD, golden patient, patients that need revision operations, and patients who are at home, and patients who are can be delayed or cancelled. Because, for example, in our scenarios, as previously mentioned, we had 2 theater lists, full day, and we had one list was purely for revision, and there was a hip revision surgeon, and the other one was a senior registrar. So the revision list, put the revision cases. It's out of your mind, and these will exhaust the whole list. Now you have the rest of the cases to put on the other list. So again, CPOD, who's your golden patient? Which patients can you do today? Which patients can you cancel? Which patients are at home? And based on that, you can just write alphabets next to it. And then you will find yourself these 10 minutes are to your benefit. I didn't manage to finish it all. I had 3 cases left, but in the last 30 seconds, I was prompted to be told that there are 30 seconds. And I had to go through the last 3 patients who were at home to tell them quickly what I needed to do. And honestly, I didn't score that time prioritization. I scored around 39 out of 50. And those are one of the reasons why my ranking came slightly down. Now for the communication, it's all about the important bits, which are, so the year before they had a different structure. They had a different kind of flow. This year, we had a never event. We had things related to GMC standards. We had things related to ethics, so on and so forth. Previously, it was more about talking to a patient, so it was divided into 2 parts. The first part is taking history, consenting them for whatever procedure, checking their capacity, talking to them through their consenting process, Montgomery ruling, making sure that they understand the risks, the benefits, and the things that matter to them, answer their concerns, be empathetic, show good communication skills, gathering information and giving them appropriate information. And then the second half was about talking through your WHO checklist. So you have to know how to present your WHO briefing, which is here. introduction team members, demographics, the procedure that you need to do, anesthesia, past medical history of the patient, your day in, day out practice at work, and what kind of positioning, what imaging is needed or not, the kits that you need, what's your approach, and you need to talk through your approach as well. And all of this is in 10 minutes. So with practice, these are all things that you can improve on, and that you can master. But for us this year, I don't know how it's going to be like the next year, but it would either be one of those two. The important bit is to try to keep practicing and try to be aware of the GMC standards, read through what are the never events. There is a document that tells you what are the never events, like for example, wrong-sided surgery, for example, missing something that's very important, prescribing a medication to a patient which you should have never prescribed. Make sure how do you escalate, know about the escalation process, how to incident, different types of incident forms that you need to fill. Duty of candor, very important. And there's a bit here which I've written about how do you approach a duty of candor and what's the importance of it. So it's same as the STAR scenario. Situation, what's the situation? Tell the patient about the incident that happened. Be honest. Tell them that you will write a formal apology, that you will document in their notes the conversation that happened. Escalate to your consultant, morbidity and mortality. Mention that you will do an audit. Mention that you will do a presentation, and mention that you will keep the patient informed about what happens. How will you resolve the issue? What are the follow-up plans? Mention that you want to mention this to your education and clinical supervisors, reflecting ICP portfolio, so on and so forth. I felt I did really well in the communication station. I think I might have my feedback open here as well. If I can open it really quick to you. Yeah, there it is. So this is my communication station. So in my communication station, I scored 34 out of 50. So I got a station which is about a never event, similar to my colleague, I think Rami, where essentially it was a pediatric patient had bilateral femoral plates. One of them was removed, the right side, and the left one was still there. The plan was to do the left side, but we mistakenly operated on the right side. And how do you approach it? This is another event. Mention it early. Mention how will you escalate it. The important bits they wanted to hear in that station, looking back at this, is that I had to tell the consultant to stop, check the consent. The consent did show that it's the right side, although we needed to do the left side. So that means that the consent is wrong and we're operating on the wrong side. And the patient has signed to have an operation on the right side. So that means we cannot proceed with the operation, something that I did not mention. But I mentioned that I will make sure that I escalate this, that I discuss this with the patient's family, so on and so forth. But the ideal scenario, what they're looking for is that you needed to inform the anesthetist, tell your consultant, consent says right, we still need to stop. We probably need to make a new consent, re-sign the consent before take the patient's, because it was pediatric patients, it was consent form 2. We need to take the parental consent to be able to proceed with the left side. Only then you can proceed. So these are the things that they wanted to hear. There's a lot of times you'll be taken off guard of scenarios or situations you've never been through before. And this is why these sessions are important, so that with every new experience, you just note down how do you approach it. And the consultants who have been through it, they will keep improving your answers as you keep practicing these scenarios with them. So essentially, they're looking for the way that you communicate. How do you gather information? How do you give information? Your situational awareness, that is, you're not just tunnel vision about one thing. You're aware about how this is going to affect the family, the child, the incidenting process, escalation, complaints, and the follow-up for the patient, that they will have a scar again, they will have pain on that side, so on and so forth. And how are you judged under pressure? So I was put under pressure that the examiner told me, but the consent says the right side. So how are you still proceeding with the left? So I told him that I will make sure that the consultant has enough support to proceed with the left, and then I will go out and make sure all the paperwork is done, which is not the ideal answer, but I still thankfully did not score 0. So there are some ways where you can pick yourself up, but of course, these are all avoidable situations which can cost you a decent rank or a seat in the training program. And finally, technical knowledge and clinical expertise, which you need to show how you can apply your knowledge, that you've understood the importance of this duty of candor, as we've mentioned earlier here before, and about how do you approach it and how do you reflect on it. So finally, this is all my pointers that I want to mention. And hopefully in the future sessions, we'll be talking more about more insight and about experiences, and as we practice for the sessions, and I'll probably be one of the candidates to practice as well, then we can definitely share our experiences to make the best of our sessions. I think that's it. If anyone has any questions, feel free to email me or ask in the chat.
Well done, Ziad. Thank you so much. Guys, I think you made it very, very easy for the new applicants. They have already the experience, and all they need is just your tips and tricks. Very well done. All of you really, really good. So, guys, do you have any questions? We already 90 minutes plus. Islam, do you have anything to add?
Hi, guys. So thank you so much for all who presented today, starting from Ashur and then Wahb, Rami, and Ziad. You guys really did like great presentations. And for others who have this experience for the first time, you guys are very lucky to have such organizations supporting you. You are very lucky having those colleagues presenting their experiences. I remember first time when I was applying, I didn't have such things that makes everything easy. I was digging myself and trying to figure out what's in there, going through the self-assessment on my own, trying to maximize my points on my own, and just like trying to find people to practice with. So now we have got a community. We have to get more attached to each other, strengthen our connections, build our community, and make it grow up. So thank you guys. This was really helpful, and hopefully we will do like regular meetings about like mocks and this kind of stuff just nearby the interview. And I'm more than happy to be contacted for anything. So you guys know what I am. Thank you, Mr. Hashim, for organizing this.
No worries, man. So let us stop the recording first.